My name is Sharylle Ellington. I'm a Googly woman from the Mossman area. I work as a manager of the Mossman Gorge Primary Health Care Centre, which is a community-controlled organisation. I basically followed on from my mum's footsteps, I suppose. Mum was the first indigenous health worker for Mossman Gorge. I've been the indigenous health worker here for almost 20 years. I started way back when. I've seen the growth of community in such a way that it has. The journey of Mossman Gorge to me has been such an uplifting experience, because I've travelled in that journey with Mossman Gorge, and being a community member, being a family member, it has given me such a sense of pride to see the work that my mum actually started, to see it come to the fore now. The community lobbied for over 30 years to have their own doctor, and so where we stand now, to me, is one of the greatest achievements that on a personal note, for myself and for my mum, to see the hard work that the community has put into lobbying for their own medical services, having access, on their doorstep, their own medical services is, as I said before, such a great achievement for them. And we've come such a long way, in a sense that understanding the needs of the clinic, understanding the good work that community have put into the clinic, because due to community control, we wouldn't be here today. If community hadn't been empowered to take that step, we would not have been here today. We wouldn't be economically viable as we are now. We wouldn't have the, how can I say, what I love most about it is when you walk through the front door of the clinic, it's Yalnji people that you meet. And I have kept that sense of well-being and strength among my workers, and to have the same workers in that clinic for 6 years, to me, is an achievement, in a sense that the working arena is a lovely environment, is a nice environment to work, even though we have our social determinants just as much as any other community. I feel that the sense of empowerment, as in community control, has given community strength. Well, no, not that I sense, because if community wants the service will be successful, and it has been, and it's proven here in Mossman Gorge, because this is what community wanted, and this is what community got. And as a manager, the flexibility of the service, the flexibility of policy and procedure, working from a cultural point of view and allowing community to have a say in those policy and procedures, has given us the flexibility to work outside the scope of the rigidity of normal institutions, I could say. Yeah. And I know because I've worked in other institutions, and indigenous health, you have to work outside the arena. You have to step outside, not so much your scope of practice, but the scope of everyday work. And as a service provider, well, you're not seen as a service provider. You're seen as a community member, a family member, and you're here to look after your family and community. And so that's what is expected of you, regardless of whether it be 2 o'clock in the morning or 8:30 in the morning when you're opening clinic. So, it's and also, upon saying that, just the words of my mother coming through, when she initially started with Aboriginal health back in the 70s, and I was 12 years old, and she said to me, daughter, these people that I work for, they're going to have Aboriginal health fixed in 10 years. I had absolutely no idea what she was talking about, but because I could see that she was stressed, I said, oh, okay, Mum. And so to see, this is 30 years ago, 40 years ago, and to see what we have today, and yes, we are getting better. Obviously the gap is still there, but we're closing that gap.